This is a Global News special presentation.
Good evening and welcome to our special Global BC COVID-19 Townhall, navigating the COVID-19 crisis. And for the next hour, we will be taking your questions and asking them of some of those spearheading the province's response to the pandemic.
That's right. Many questions were submitted online beforehand, but we're also on Global BC Facebook Live, where you can send in questions for about the next hour or so. So we'd like to welcome right now Provincial Health Officer Dr. Bonnie Henry and BC's Health Minister Adrian Dix, joining us now live from Vancouver. Thanks for doing this.
Good evening.
Good evening. Great to see you, Chris and Sophie.
Okay, we'll launch into those questions in just a moment. We also want to point out that Premier John Horgan also spoke with our Keith Baldry earlier today. We will have his answers to your pre-submitted questions as well. But as you know, of course, coronavirus has affected every Canadian deeply in such a short period of time. It was only January 28th when BC recorded its first presumptive case of novel coronavirus. In the past 7 weeks, though, things have changed dramatically.
Today in BC, there are 250 confirmed cases, and there have been deaths. Now, the province is in a state of emergency. Our viewers have been submitting questions to our website this week, and you can still, as we mentioned, get your questions in on Facebook Live. So I want to encourage both of you, Dr. Henry and Minister Dix, to answer once we get moving here. So let's get started with some of the most popular questions that come up over and over again from folks.
And we're going to get into some very specific health-related questions in just a sec, but we want to start with a question that has been coming at us a lot today, Minister Dix and Dr. Henry, and that is why not take more stringent measures? We've seen what's happening in places like Italy, cities like San Francisco in lockdown. Is it time for us to take more drastic action now?
Well, I actually think we're taking very drastic action. It's a challenge to get it right, and we'll never get it right. I think we've taken some very dramatic actions just really within the last few days. It takes a little bit of time for people to understand what that is and to understand what it means. And we're seeing that transition, that realization of how important these measures are. So we have to find a balance of making sure that we do allow essential services and goods to be coming back and forth to support us, to be able to take these measures. And we'll be watching it carefully. So clearly there are additional things that we can take if we need to. But right now, really what we need is for everybody to do their part around the social distancing, around physical separation, and as we've been talking about, making that social connection still.
And Minister Dix, can you assure British Columbians that those measures are going to be enough, that the social distancing and self-isolating when it is appropriate are enough to prevent the kind of drastic infection we've seen in Italy?
I think what you're seeing is the preparations, first of all, the whole health system. I mean, on Monday, we made at least what was for me, a very dramatic decision, which was to cancel all non-urgent elective surgery. That's thousands of people's surgeries that, as you know, Chris, people have been waiting for. Many people in your audience tonight have been waiting for a long time. And why did we do that? We did that to free up hundreds of acute care beds so that we prepare, so that we're ready in advance for what might happen in the system. And that is, of course, a huge cost for people. There's a health consequence to not proceeding with surgery, but it's action that we had to take. And I think what we want to say tonight especially is that this isn't optional for people. This isn't a choice. We need people to take these steps. That means that if you've been outside the country, you must socially isolate for 14 days. You must stay at home and isolate yourself for 14 days. If you're sick, and we've been saying this for the 9 weeks we've been doing presentations and briefings, if you're sick, you must stay home. This isn't an option. This is your obligation to the people you love and everyone else in society. These can be profoundly important measures. The hand washing and all of the things, they may not seem like they're a lot, but they are profound changes in the way society works. This week we've seen the closing of all bars. We did that on St. Patrick's Day, which, as you all will remember, we've seen the decision to stop classes in schools. These are profound changes that have their own impact, but we have to take these steps now. But they will only work effectively. We will only work effectively if everyone out there watching says, this is my problem too, and does it.
Minister Dix and Dr. Henry, you've both driven home that message every day during your press conferences. You know, we totally appreciate that. But people are still not doing many of those things. People are still congregating in places. They are not practicing social distancing. So at what point do you step in? And you say it's not an option, but at what point do you step in and actually use the enforcement that you now have the power to use?
Well, I don't think it is an option, and I think this is what we've learned. It's not an option for people in BC. And the fact that some people, I think the majority of people are responding positively. I hear that every day, and it's inspiring to watch what people do. So that's the positive side. And the fact that some people may not have yet joined the fight doesn't mean that the obligation on anyone is any less. And so we're saying that it doesn't matter if there isn't someone on your block enforcing this at a particular moment. This is your obligation as a citizen, and we expect it to happen. And yes, there may be some need in the future to use other actions. But what we are asking to do now, what makes it effective now, is for individuals to act, thousands, tens of thousands of them perhaps, to act and to follow the advice. It's what we need to do now, and we need to be convincing. We need people to feel that this is their fight. And there's something empowering in that, and too, for everyone watching.
I also think, you know, yeah, and you know, people have asked, well, what does this actually mean? And so we've been trying in the last, I have been trying and very much in the last few days to say, this is what it means for you if you're in a school, if you're in a playground, if you're at home, if you're in a workplace. You know, we need to have the limits that allow people to take the measures, and they need to know what to do. And my experience and our experience now is once people really understand what they need to do and are given the means to do it, they will. Which doesn't mean that we won't enforce it if we need to, and we have had a few occasions where that has happened.
Dr. Henry, you might have the expertise to answer this question from Mary up in Campbell River, who wanted us to ask you if you know this, if the virus is mutating. Are there challenges in trying to nail down a vaccine, but really is the virus mutating from what we saw in China?
Yeah, so a really interesting question, because this is an RNA virus, so it has a single strand of genetic material. So every time it replicates, there's a potential it's going to have a spelling error, if you will, and make a mistake or create a mutation. So there are slight changes in the virus that we've seen, and one of the things that helps us understand is where the virus came from. So for people here in British Columbia, we have been sequencing, they call it, the genome of the viruses here, and we know that early on, most of them came from China, not surprisingly. But the more recently, they've been coming from other countries, and we know that the ones that come from Iran are a little bit different. And most recently, almost all of our cases have a strain that is seen circulating in the United States. But if we mean, is it mutating so that it makes people sicker or that it makes it more resistant to any potential treatments, we haven't seen anything like that yet in terms of mutations. And so there's a lot of work being done about developing a vaccine, and it's based on the genomic sequence that is conserved. That's the same for all of those viruses.
All right, I have to say apologies to Minister Dix, but I think a lot of these next few questions will be for Dr. Henry. Dr. Henry.
That's fantastic. That's fantastic. That's as it should be.
We'll get to you, Minister Dix. Don't you worry.
All right. No worries. No worries.
Craig from Victoria asks, how long after being infected is someone contagious?
Yeah, and that's one of the key questions that we've been trying to work out. And it's one of the things that we need to know when a new virus arises. Are you contagious? Are you infectious to others before you get sick? How long does it take before you're infectious to others? And then how long after you get sick are you better? So right now, what we have been using is the criteria that was developed in China that if you are sick, even if you have mild disease, we are waiting till your symptoms get better, and that you have to have 2 negative tests before we can say, okay, we're sure you're not infectious to others. Now we're seeing some studies that come out, particularly one in Germany very recently, that showed that you couldn't find live virus from somebody after about 8 days after the symptoms started. So this is people who had mild disease. It's a little bit different if you've had very severe disease and in hospital, and you can actually be infectious for quite a bit longer. But for people with mild disease, which is most people, we know that about 80% of people have a mild illness, and we're seeing that here in BC as well. So we've been looking at these studies that have been done, and the virus, so the test that we have right now looks for pieces of the RNA, the genetic material, but that can be in your body for a long period of time. Doesn't mean that that virus is actually live still and can infect somebody else. So now we're seeing probably about 8 to 10 days after your symptoms started. If you have the mild disease, you're probably not infectious to others anymore. So for most people with a mild illness, and now we're saying if you're somebody who's traveled and come back to Canada, you need to self-isolate, you need to stay at home for those 14 days. If you have a mild illness in between there, you're not infectious 10 days after that illness started.
Okay, we've got another one from Campbell River, this from a woman named September. And she asks, how long does the virus live on hard surfaces? A lot of people wondering about how and when to clean, but how long does the virus live on hard surfaces?
Well, a lot of stuff has come out about that recently as well, and it can be hours to maybe a day, depending on the surface. So it depends on all kinds of stuff: how much fluid it's in, so how big a droplet there is, what the surface is, if it's cloth or if it's steel, what the temperature is, what the humidity is. So the bottom line is probably a few hours, maybe. And that's why it's so important to clean those high-touch areas really frequently. And if there's, in hospitals, for example, we do that very fastidiously, frequently. But in most places, if there's somebody who's sick, you want to clean those areas around them with regular household cleaners. That's the other nice thing about this virus. It has what we call an envelope, so it makes it very susceptible to just routine household cleaners or a 1 in 10 bleach solution. So washing those high-touch surfaces or places around where somebody's coughing, around their bed, around the bathroom, and those sorts of places, your kitchen, frequently 2 or 3 times a day, if somebody's sick in your house, is good. And the other really important thing is we know we're out, on transit, in the environment, and we touch things all the time. And it's easy to kill this virus with soap and water. Soap and water is your best protection, or to use alcohol-based hand sanitizers, and that will kill the virus on your hands so that you don't inoculate yourself with it.
Okay.
Good to know.
Can't clean enough. All right, Vivian from Facebook wants to know how long it took those who have tested positive to recover.
Yeah, so most of the people, so we've only reported 5 people who've met that testing criteria that I've told you about to be considered recovered. But most people have had an illness, so of the 200 and some that we've had in BC now, most people's illness has lasted 3 or 4 days and then has recovered and has been relatively mild. Some people have had a persistent cough for a while, and that's not unusual. People who have asthma or other respiratory illnesses, the cough can last for quite a bit. So I'm expecting that very soon we'll be able to say that way more people have recovered. So most illnesses last about 3 or 4 days.
All right, one more before we go to break really quickly. Sherry from White Rock works in healthcare and wants to know, if you contract COVID-19 and recover, can you be reinfected? Quickly.
Yeah, that's a big question. We're not sure, but probably not, and probably not right away. It may be, if the virus changes over time, that you might be able to be infected again, maybe next year. But right now, we don't think in the short term people get infected again.
All right, thank you.
A little bit of good news then. All right, Minister Adrian Dix, Dr. Bonnie Henry, stand by. We have the pair of them with us for about the next 45 minutes. And coming up after the break, we will check in with Premier John Horgan about the toll coronavirus is taking on the BC economy. Stay with us.
I think there is no question it's going to have a big impact. It is likely we will have a deficit.
Well, COVID-19 has caused havoc on the stock market, and interest rates are being slashed to incredible lows. The loonie now below 70 cents US, and iconic Canadian retailers are closing.
Restaurants are closing as well, or going to take out only. Thousands of people are out of work. So what does all of this mean for BC's economy? Keith Baldry took your questions to the Premier in Victoria earlier today.
Yes, I'm here in the Premier's office in Victoria with Premier John Horgan. Some of our viewers have sent us some questions. I'm going to put them to the Premier right now. So thanks for doing this, Mr. Premier.
Good to be here.
So one of the questions we had from a number of viewers, worried about what they're seeing with the stock markets tumbling, all sorts of mayhem out there. Do you think we're headed inevitably towards a recession?
Well, I don't want to speculate on what's going to happen 2, 3, 4 months from now, but I do know that government revenues have dropped off a cliff, not just here in BC, but around the world. The private sector is retrenching. The stock market is extremely volatile. Volatile, in fact, doesn't even come close to describing what's happening within markets. But the good news about all of this is locally we've seen people step up, small businesses, large businesses here in BC, trying to bring together a Team BC approach to make sure we all get through this together.
Now, you mentioned government revenues hemorrhaging, I guess. Does that mean, again, a deficit is inevitable? Finance Minister Carol James seemed to suggest that just a couple of days ago. And at the end of the day, does it really matter?
Well, and that's a very good point. Less than a month ago, we tabled a balanced budget that had a forecast of balanced budgets for the next 3 years. And it was looked at by financial analysts and others in the marketplace saying, yeah, that's a prudent budget going forward and consistent with where BC's economy is with respect to low unemployment, lots of private sector investment, a diverse economy, resource-based, high-tech. All of the things that we have in British Columbia are our advantage, not just in good times, but in crisis. And so as we see revenues plummet, we also have to know that when we stimulate the activity to come back into play once this crisis passes, we're going to be in a pretty good place. But this is going to be a difficult time going forward. And on to the question, does it really matter? I didn't get elected. I didn't seek public office to just balance budgets. I sought public office to provide services for people. At the end of the day, that's what governments are supposed to do. Pull away all the politics. Is the healthcare system working? Are my kids getting the quality education they need? Are my parents being cared for in their latter years? Those are the basic things that people expect from their governments, and we'll continue to deliver those services regardless of what the finances look like.
Okay, well, one of our viewers, Mary Sue, who's been volunteering at the First United Church in the downtown east side for a number of years, has asked us to ask you, will there be relief for low-income earners if they have to go in self-isolation, self-quarantine? And also, is there any chance there'd be a ban or moratorium on evictions?
Well, what we've been looking at is, of course, the federal package, which was announced yesterday. Minister James is working on the BC response to that, filling in the gaps, basically, that the federal government wasn't able to answer locally here in BC. And our priorities are going to be for the most vulnerable populations. And the questioner absolutely understands that the vulnerable populations in the downtown east side and other vulnerable populations across the province have to be a high priority. But in this instance, it's not just the vulnerable that are affected. It's low-end employees, middle-class employees, and in fact, small businesses that had been thriving up until now who are looking at serious cash flow challenges. So we're going to try and put together a package. We'll be announcing it on Monday that'll meet the needs of low-income and vulnerable populations, help the middle class, and also make sure that those businesses that are having significant cash flow problems are not going to have to close down because of this crisis.
Now, another one of our viewers, Carla is her name, quite upset with what she's seen on our newscast in terms of people hoarding and stockpiling and such. Is there any measures your government's going to take to prevent that and as well as price gouging?
Yeah, these are, I'm with you on this, Carla. These are the sorts of things that raise the anger of regular folks. You know, what I've seen more than anything else over the past couple of weeks is the extraordinary good nature of Canadians and British Columbians helping each other and calling out people who are profiteering, calling out those people that are hoarding. And of course, retailers are going to do their best to limit the number of products that people can take away. I think that's important. We've been working with the Retail Council of Canada on that, and they understand the challenges within the supply chain. It's in good shape today, but if people act irrationally, that'll have a negative impact. Minister Farnworth has evoked emergency powers here in British Columbia. He's also responsible for consumer protection. So if we see that type of behavior, you can assure, I want to assure your listeners and your viewers that we're going to crack down on that pretty hard. There's no space for profiteering in a time of crisis. We want the better parts of our character to show through on days like today.
And finally, a number of our viewers want to know, what's the one thing you think British Columbians should take away from this crisis that we're all part of right now?
Well, what's really been evident to me, Keith, is that as I talk to regular people, whether they're operating small businesses, I've talked to the captains of industry, the largest companies in British Columbia as well, and regular people, all the way through the whole spectrum of British Columbians. And to a person, people have said, not me, but what can I do to help you? And it's inspiring as a leader of a government, whether it be the opposition parties working with us together to find a way forward, whether it's industry, labor, everybody, the not-for-profit sector, all of them saying, almost with one voice, thank goodness for the healthcare workers in British Columbia who are putting themselves at risk to make sure that the rest of us are safe. And that sense of gratitude and the good fortune of being British Columbians in a time of crisis. People are rallying together, and I'd like to focus on that rather than limited examples of bad behavior in BC and indeed across the country. I'm proud of what we've been able to accomplish as a people here in BC, and I know in the weeks ahead we're going to be counting on that to be even more prevalent in communities right across the province.
Okay, well said, and I want to thank you for taking the time out to do this today. Chris and Sophie, throw it back to you.
All right, Keith, thanks very much. Much more to come on our special edition of the News Hour here. When we come back, we'll be asking the health minister about how prepared our healthcare system is to deal with this crisis long term.
Welcome back to our special town hall on the COVID-19 pandemic. Now, this is not the first public health emergency we have been in BC. The opioid crisis has been designated a public health emergency since April of 2016, and that crisis has killed more than 3,600 British Columbians.
It's true, and many are wondering how we can possibly add a pandemic response now to the already stressed out healthcare system. We'll go back now to our two guests. Adrian Dix, Minister of Health, you're the person in charge of BC's plan. So what's your perspective on this? Can we do this, and is there a breaking point?
This isn't the first response we've had in BC. You know that in 2003, our system responded to SARS. So really, our pandemic response has four key elements to it. First is protecting the population, and that's what you've seen over the last 9 weeks, what Dr. Henry and I have been describing in almost daily briefings to people. So that's identifying infection, breaking the chains of infection, ensuring that people who get sick are self-isolating at home. All of that is critically important. The second step is to protect vulnerable populations, and we've seen how vulnerable, particularly seniors in long-term care are with what's happened at the Lynn Valley Care Home, but just as significantly what's happening in other places, such as Washington State. So that's very important. The third is to protect healthcare workers and take the steps necessary to do that. And the fourth is to ensure we have the resources in our healthcare system. So when we decide not to do a whole series of things, as we have in the last week, not to do, for example, non-urgent elective surgery, it means we create the space to respond. But look, this is a huge challenge. And I think our healthcare workers have done extraordinary work, but we all have to help them out as well, because our success ultimately depends on what everybody in the audience tonight does, that they follow the advice that's been put forward by Dr. Henry, so that we can push transmission back and back and back, so that we can push it, for example, past the end of influenza season, so we're not dealing with influenza and COVID-19. So these are the steps we're taking, and it's a huge challenge for the healthcare system, one that our extraordinary healthcare workers are taking up. I hear that every day, and we have to celebrate and recognize them, but
doubt.
Also one that we need everyone to be part of, right? Everyone's part of this answer. It's not just the government, it's all of us. It's the whole society, it's everyone in the audience.
We got to plank that curve, as we heard today. Plank it, not just flatten it, but plank it. Right.
Absolutely, and we can do it minute by minute every day.
Okay, very, very popular question since this whole thing began. How effective is wearing a face mask? Dr. Henry, I'll give that one to you.
Yeah, so if I'm not sick, it's not effective. It's not something that when I'm out in public, it's going to protect me in any way. And as a matter of fact, people often fiddle with it and contaminate themselves, and it can lead to more risk. Where it is incredibly important is in the healthcare system, and we need to make sure we have masks and respirators for our healthcare providers to make sure that they stay safe. And if I am sick, then a mask can help. It can help keep my droplets in so that I'm not infecting others.
All right, we have another one from Facebook Live here. We want to get our first question from Elise Andreas, and she's watching in the Shuswap. She's an early childhood educator, and she wants to know if there is a plan to close daycares, and if so, would you establish emergency child care centers? What's the plan there?
Yes, and that's something that, so there's no order to keep daycares open or to close them. What I've said is we need to have daycare, that it's essential that we have support for our families, particularly of the essential workers and healthcare workers and other essential workers in our community, to be able to respond. So that's what the strategy is working on right now.
And we know this, Chris, and we know this to everyone in BC, that our healthcare workers need childcare. And so whether it's doctors or nurses or care aides or people who keep our hospitals clean and infection-free, all of those people are going to continue to need daycare. So when we take action on schools and canceling classes, we got to make sure that we're taking the actions that allow people, for example, who we absolutely need in the community, from ambulance paramedics to everyone else you can imagine, to police and fire and everything else, have the supports they need so that they can keep society running and keep the healthcare system running.
Okay, next question is from Elena in Surrey, although I've heard this question asked from many people. Elena wonders if we have enough ventilators and the people trained to use them.
Well, we have in BC, we've said this at one of our briefings because people asked us, and we've tried to give all of the information, all of it, the good and the challenging. We have 1,272 ventilators in BC. About 956 of those are traditional ventilators for hospitals or critical care ventilators in hospitals, which is relative to other provinces quite a few. But obviously, we're facing a pandemic, and that's a challenge. We're seeking to get more equipment, and we are looking to get more equipment. What I've said to people is we're going to be totally transparent so that people know exactly how many we have and when they arrive, and that's what we're going to do.
All right.
Coming up, when COVID-19 started arriving in BC, some people wonder if we acted quickly enough at points of entry to stop it. Could we have done more? We'll dig into that a little bit as our special on COVID-19 continues.
Welcome back to our virtual town hall. We knew that the virus was arriving by plane into BC. So did we wait too long to screen people at YVR?
We're going to check in with our two guests. So we've got Health Minister Adrian Dix with us, and Chief Medical Health Officer Bonnie Henry is with us as well. So what's your take on this? When we first started seeing some of these cases, it was obvious that the entry point would have been our borders. Some people concerned that maybe we didn't close them sooner or screen people at YVR. Can you defend the policy that we had, and was it enough in hindsight?
I think it's really challenging. We know from experience that closing borders doesn't work, and we can just look at what's happened in our neighbors to the south, and to see that it doesn't protect you. What we do need to do is to be able to detect people early, give people the tools so that they know what to do if they get sick. And I think, we did a very good job in some parts of it, probably needed to provide more information to people. But the reality is we did detect most of our first cases were travel related, and we found people, and people did the right thing. So that was good. I think the challenge has been that you just can't suppress this virus forever, and it has been spreading in communities all around us. And eventually it's going to make its way here.
So that's talking about.
I think, Chris, the comparison between British Columbia and Washington State, there were measures taken, as you know, to stop flights, for example, from China and Washington State. But some of the other measures, they have an outstanding public health care system, lots of people working very hard there, but some of the other measures weren't in place. And the main response we have to do is a public health response, helping people to deal with the virus who test positive and are dealing with it, but also limiting it. And that's what we've been focused here on in BC. So I think you see in the comparison that even though they took an immigration approach in some ways at the federal level in the United States, that it's still a major problem there as well.
Okay, so that's talking about international travel. Farzana in Surrey wants to know if it's safe to fly between provinces, so across Canada.
You know what? It's becoming more and more challenging because we are seeing people with this virus in every province in Canada now, not yet in the territories, which is good. So right now is the time to stay put, to stay home, to do the social distancing, to take the measures that we need in our community here to best protect everybody.
We've got another question here, Dr. Henry and Minister Dix, from Gagan in Surrey. Other places where we see large groups of people gathering together are transit buses and trains. I know TransLink took some measures today to change how people get on and off buses. These obviously are deemed essential service, and this viewer wants to know how you'll ensure that social distancing on a bus and SkyTrain is maintained. Should we be allowing only a certain number of passengers on? There are obviously some concerns about mass transit here.
So there's a couple of things about mass transit. It is a critical function to allow people to get to work in our healthcare system and other places. So we have given some direction. We've been working with the public transit, TransLink and other places to make sure they have things in place like being able to manage the numbers of people, frequently cleaning, having protection for the workers in the area. So those are things that they've put in place. I understand as well, that ridership is down quite a lot because of what we're seeing. So they're able to manage the numbers that we need and to keep things moving as well.
All right, JD from social media asks, if the focus is still on seniors now that there are more cases being reported in younger populations, although I'm not sure what all the demographics are here in the cases in BC.
Yes, and the focus is on protection of the seniors and elders in our community because we know from around the world, we're seeing it in Italy, we're seeing it in all around Europe, and we've had detailed information from China that the older you are, and if you have other underlying conditions as well, like diabetes or heart disease, you're more likely to have severe illness, and unfortunately, you're more likely to die from this. And we've seen that, unfortunately, here where we've had an outbreak at a long-term care home, and our 8 families who've been seriously affected by this, and they've all been elderly people. So we need to do these measures now to protect the seniors and elders in our community.
Dr. Henry, we've heard from some viewers who know that there are people who have come back into the country and are not heeding the 14 days of self-isolation. Is there anything the province can do? This one specifically from Cassandra in Burnaby wants to know what's being done to enforce self-isolation. Is there anything more that we can do to make sure that people adhere to this very important regulation?
Yeah, it's such a challenge because we know there are large numbers of people, and most people are doing the right thing. And so that is important. I did issue an order, so it is a legal requirement for people to take these measures, and we can enforce those orders if we need to. But really, the onus is on us as individuals, as collective in society, to do the right thing around this, and it is our families and our own communities that will suffer if we don't. So everybody needs to do this now. They need to take these measures, and we need to do it together.
It's a powerful message.
Remember, just remember, even if you haven't followed for, say, a couple of days, now is the time to start. This is our responsibility to one another. Even if you haven't followed the rules up to now, which most people have, now is the time to start. This moment, today, right now.
Absolutely. All right. Minister Dix, Dr. Bonnie Henry joining us for a virtual town hall. When we come back from a break, more of your questions about how to stay safe.
All right, we just are getting news that the governor of California has ordered all 40 million residents of that state to stay at home to limit the outbreak. And as we're just learning that, maybe I'll get a reaction now from our two guests, Dr. Bonnie Henry and Adrian Dix. When we see that kind of
a step
or a measure from California, does that make you think about what we're doing here at all?
You know, of course, it makes us all very concerned. I mean, it's the population of our country. You know, we are taking quite drastic measures in a very short period of time, but it is so important that everybody take these seriously and that we do what we can now.
I guess that...
And what we see elsewhere in the world, Sophie, I'd say what we see elsewhere in the world tells us that we have to take tough measures here, and we are. And we have to be prepared, and we are. We will get through this, but it is a massive challenge, both for our healthcare system and our people. And this is what we're saying. I think the message from California is the same message from Washington, the same message from Korea, and from Italy, and from China, which is that it's up to all of us, and we've got to take action tonight.
Yeah. People need to take this seriously, and that directive from Governor Newsom really emphasizes that point. Okay, back to our questions now. Let's talk about the difference between all these terms we've learned: social distancing, self-isolation, and quarantine, if you can quickly.
Right. Okay, so isolation is what we do for somebody who's sick. So if you have any symptoms at all, if you're feeling unwell, then you need to stay home. You just need to stay home, not go out, not have contact with people, take measures in your home not to spread it to others. That's isolation. Quarantine is what we call it when somebody's been exposed, so exposed to the disease but is not yet sick, is in the incubation period. And again, people who are in quarantine, we want them to stay home because we have no treatment, we have no prevention for this. So if you've been exposed, I can't stop you from getting sick. So we need you to be at home, to be away from others, so if you do get sick, you're not going to pass it on to others. And that's how we stop the transmission. Social isolation and social distancing is about the social distancing is about all of us and what we all need to do now, and it's about putting some distance between us so that we are able to stop this virus on a community level, on a provincial level, all of us working together to take those measures that make it much more difficult for this virus to spread.
Okay, thank you, Dr. Henry.
All right, we have a video question submitted on video. This is from Michael in Chilliwack, so we'll get you to have a listen and a watch.
Would it be fair to say that social distancing is with us until an effective vaccine has been developed?
That's a good question.
Yeah.
You know what? That's a very good question. And some form of it, I think, part of it will depend on if the virus changes. Sometimes when it moves through populations over time, it becomes causes less severe illness. And we've seen this with other coronaviruses, but we don't know that yet. So the most important thing and why we're doing what we're doing now is to buy us that time, flatten out, plank that curve so that we do have time to have a treatment or a vaccine to protect people.
This could be, I wonder if it is, the end of the handshake. Who knows? We'll see. Certainly getting used to doing not even the elbow tap anymore, but
the wave across the room.
The wave across the room now.
Dr. Bonnie Henry, Health Minister Adrian Dix, our guests on our virtual town hall. We'll take a break. More of your questions coming up. Unprecedented times. We have Chief Medical Health Officer Dr. Bonnie Henry and BC's Health Minister Adrian Dix with us, taking your questions on the COVID-19 crisis. Ginger is our next question. Ginger asks, how can the province cancel medical procedures like diagnostic testing and elective surgeries? What words do you have for those people who are waiting? Minister Dix, I think that's a question for you probably.
That it's absolutely gutting to do that. One of the things I've worked on for a long time, I know a lot of people have contacted me in this week since we did that, and have told me what it means to them. And I know what it means to them, whether it's a hip and knee replacement, whatever it is. These are surgeries that make a huge difference in people's lives. What we have to do, why we have to flatten the curve, why we all have to take action, is so we can get the healthcare system back to doing all of the other things it does. We are taking care of a number of urgent procedures, such as cancer and others, but we have to get the healthcare system back to all the other things it does, and that means we all have to take action now. But I know, people have been in touch, I know what it means to wait months for surgery in pain and then have it delayed again. It's a real blow to people. We didn't make that decision simply. It was a significant decision we made. We knew the cost, but this is what we have to do now to ensure that all of us are protected and to ensure that our healthcare, our hospitals are ready for COVID-19 as it builds up in BC.
Is there no room for a case-by-case analysis, though, for the worst cases, people who are living with chronic pain, hip replacement surgery or something like that, where their quality of life is severely degraded, mental health is starting to go? Is there no room for some kind of analysis on a case-by-case basis?
Well, Chris, there is that, and that's happening in every hospital in BC. There is room, and they are, and doctors are assessing the cases. But let's not water it down. We're canceling thousands of elective surgeries, and it has huge implications for people. And why are we doing it? To create and open up hundreds of acute care beds and to be able to transfer staff in time so that they can be prepared in case we see an influx of COVID-19 patients. So what does it tell all of us? We want to get back all those surgeons, all those surgical nurses, all those people who work in surgery, who clean operating rooms, who have made that their life's work, and it's extraordinary work. We need to get them back doing those elective surgeries. And how do we do it? Well, we do exactly what Dr. Henry and I are suggesting. We take part, we flatten the curve, we act ourselves. And then the people that really need to hear from your viewer, I think, are the people out there who might be considering not following those rules. They have to do it now. All right. Thank you very much, Adrian. It's not an easy decision to make. We appreciate it.
Yeah, the repercussions are being felt everywhere. Okay, Christina is asking our next question. If pregnant women should be completely isolating, and if they and their babies once born are at any more risk for COVID-19?
Yeah, there's not been a lot of data around people in pregnancy and their children, and there's been a team though that is looking at this. And so right now, yes, if you're pregnant, we know that your immune system is not perfect, and that's part of the whole process. So yes, you should be isolating. You should be taking extra care and staying away. And we are preparing to make sure that you can safely deliver and you and your baby can be cared for.
Couple of questions, or a question that's come up a couple of times now from this one coming in on Facebook Live. Heather from Victoria wants to know why the province is not announcing which specific communities confirmed cases are in, although I do know that you have been talking about the health authorities. Yeah.
Yeah, and there's right now there's risk everywhere in all of our communities, and so we all need to take these measures. And so it's not about anymore that it's not in my community. We need to recognize that it is spreading, and it's spreading in our province, and nobody is immune to this. So that is why it is so important that these measures are taken everywhere.
All right, Lisa from Vancouver is asking if you can give us an idea. Almost afraid to ask this, but if you can give us an idea of where we will be in 1 week, 1 month, and maybe even 1 year.
Well, where we'll be in 1 week is really dependent on what we do today. And 1 week and 2 weeks is exactly, that's the incubation period of this disease. So we are dealing right now with what happened 2 weeks ago. So everything that we do now makes a difference for the next week and month, and that will determine how long we're in this crisis, how long we're able to maintain our services, and what it's going to look like. The reality is that it's going to be a number of weeks yet, and that's why we need to take so much action right now. But also there's a risk that we might have what we call a second wave, next influenza season, next respiratory virus season in the fall. So we have to take all the time that we can to prepare for that as well.
And what we're doing now is actively modeling, and Dr. Henry's an expert in this area, so I hesitate to speak too much, but just to say this, we're obviously taking the information we have from BC and from other places and trying to see where the virus is going in British Columbia, how we prepare. And all of that information, as it has been consistently, as we've reported on cases consistently and on actions consistently, we're going to let the public in on that at our daily briefings over the next week, so that there are no secrets from anyone, so that we understand how serious this is and what the effect of our measures, when we take them as individuals and as a system, can be.
What's the day you look most forward to in the future? Like, what's going to matter? Is it the day that we have no new infections? Is it is there a threshold for a number of infections? What's the thing that you cling to that's going to be positive in the days ahead?
Definitely no new infections, and where people are out of hospital and safe, and we have a vaccine that protects everybody.
Minister Dix?
That sounds like a very good day. That sounds like a very good day. And I think one of the things that most concerns us, obviously, is ensuring the safety of people, particularly in long-term care, the safety of seniors. That's why some of the toughest measures we've taken have been around those areas. But I think when we see fewer people in hospital, not more people in hospital, that will be, I think, a very good day. But we're a ways away from that yet, and that's why we have to settle in and be prepared to take these actions for a long period, for a significant period of time.
Can I give you each 15 seconds each to give us final thoughts?
You know, I've said this before, and this is something that we need to work collectively on. So be kind, be calm, and be safe.
Minister?
And I just add to be kind and be safe is follow what Dr. Henry has said tonight. Follow the rules. Do it for the ones you love. Do it for the ones you don't know. Do it for everybody in BC. We need everyone to be involved in this response. Together, we have to fight COVID-19.
And we want you guys to know that many of the people who sent in questions, in fact, the majority of them, also want to thank you and say you are both doing a great job under very difficult circumstances, and that makes them feel like they're in pretty good hands, and I would back that up too. Thank you very much both for doing the job that you're doing.
We definitely echo those thoughts, and we appreciate both of you for taking the time out of what we know are very busy schedules to join us tonight on our town hall.
Absolutely. Thanks to everybody who submitted questions or asked questions on Facebook Live. This has been a Global BC virtual town hall, maintaining, as we always try, correct social distancing. Wash your hands and do the same, and be safe, everybody.
Good night.
Good night.